Hi, everyone. Today I'm going to be discussing, I can get this to start here. I am going to be discussing psychedelic treatment for veterans with PTSD. And before I start, I just want to note that this is a very full topic. And in the essence of time, I've really focused on the altered states of consciousness experienced by soldiers. And I also am going to show a couple of videos that are kind of long, but very impactful. And so I hope you enjoyed this Teachback. Okay. Soldiers returning from deployment suffer from altered states of combat known as AS combat, which refer to specific mindsets or altered states of neuropsychological sense caused by induced hormonal activity experienced in extreme danger while in combat. This altered state in training is brought on through rehearsed states of dissociation and exposure to rehearsed violence. There's a paradoxical state of attunement within the military culture, one of external connectedness. Soldiers are trained to be connected and supportive of each other as a whole unit, yet they also are trained to have severe separation from self, an internal disconnectedness, which becomes very problematic when soldiers attempt to reintegrate in civilian life post-deployment. Soldiers experience an altered state through deprivation of basic human needs and constant survival threat. They also experience altered state with the gear and weaponry that they utilize in combat. And one example was night goggles, and that soldiers have the ability to see beyond human ability in the nighttime when using these goggles, which creates almost an altered state of superiority or superpower, that they're like superheroes. And there can be an addiction to this altered state. Soldiers are involved in daytime operations that perhaps they've only had 1 hour of sleep. They're outdoors in extreme temperatures with heavy gear. And this is where we see this altered state of disassociation with their needs. They have characteristics of near-death ecstasy. And this happens first in combat with this fight-flight altered state, together fighting in battle, but then coming out of battle and experiencing a state of ecstasy in the thought that they've survived, they're alive, it's the victory. And so soldiers can experience almost a withdrawal from these high levels of altered states of consciousness, both in the fight or flight and the euphoric feeling of victory. Soldiers also experience disassociation with wartime savagery, and they are trained for mental armor to disassociate from emotions that keep at bay ethics, love, empathy, or any other emotion that chances the impact of safety on the team. Also, soldiers are putting their destinies in the chain of command. They're told where they need to be, when they need to be there, how they need to be there, and they have disassociated from the freedom of choice. And this becomes very a, a conflict when soldiers reintegrate back into civilian life, because all of these altered mindsets that they've been trained for and experienced, now their families, their employers, society at large is expecting them to have altered sense. For example, being able to make decisions for themselves, for living a state of consciousness that's baseline versus up and down. Being able to connect with others in a more simplistic individual means, and also having connected with their internal selves. And so herein lies the conflict that leads to post-traumatic stress. Notably, these altered states are experienced as both horrifying and exhilarating, while underscoring military cultural codes of collective pride and group loyalty. So our soldiers, they return back from deployment, and they are no longer living the culture of the military, and they are also not in their collective group experience any longer. I'm going to share a video with you called Nick's Story that is truly impactful and demonstrates the essence of psychotherapeutic services on post-traumatic stress disorder of veterans.
I was introduced to climbing when I was a midshipman at the Naval Academy. Going through buds, I was given the opportunity to start climbing outside and spending time in the mountains. And I've always loved the mountains. You know, climbing is it's my release. It's the center point of my goal setting. And it's kind of filled that void that I lost when I walked away from the SEAL teams. And I no longer had, workups and deployments as kind of my goals. And now I have that in my climbing and then going outside and being in an environment that I just have always loved. My name is Nick Norris. I served for 10.5 years in the SEAL teams as a officer after graduating from the Naval Academy, and was lucky enough to deploy to combat twice and did a total of 3 deployments as a SEAL. The 10.5 years I spent in the SEAL teams, I was hyper committed to being the best SEAL officer and leader that I possibly could be. That was top priority. My last deployment, we were turning over with an East Coast team in Afghanistan. We had finished our turnover op, and our sister platoon was on the ground conducting their turnover operation. And we lost a helicopter on insert. And that one was really hard because there's a young SEAL officer named Brendan Looney that was on that bird, killed along with a bunch of other SEALs. And I ended up, taking Brendan and all those guys back to the States and then spent time with his family. And, Brendan was a Naval Academy grad, was phenomenal athlete, newly married. I mean, basically it was like, in a way, like looking in the mirror. I don't think I realized how much that bothered me. I got really good at just compartmentalizing everything. I never really allowed myself to grieve. When we found out my wife was pregnant, I had gone home to visit my brother in Colorado. My brother, Chris, was married, had a little girl, and my niece, and just had a son. He was only 4 weeks old. Fast forward about 4 weeks, my brother was killed in an inbounds avalanche in Winter Park, Colorado. And I get to see the pain that his family was going through, and knowing that my wife was about to give birth to our daughter. And for me at that point, I made the decision to get out so I could be there for my wife and my little girl, and then be around for my brother's family as much as I possibly could. I went immediately from grad school to transitioning out to, a job. Kind of internally had this goal of trying to reinvent myself and prove that I could be successful. And I focused on this new career, and I poured myself into it. And I often remember rationalizing to my wife, who questioned my absence, that it was for us and for her. It used to make me angry. I started personally seeing things in myself, the way I felt and the way I was behaving, that were not me. Namely, I felt a lot of edginess, anger. It got really pronounced. I broke down to my wife about it, and it kind of started me on this path to try problem solving, because I never want to be a victim. I always want to figure out the solution to the problem. And I started with kind of the typical, like, go to a doctor. The doctor basically described what I was explaining to him as a clinical depressive episode. They wanted to put me on antidepressants, and I resisted that just because I've seen other friends of mine have poor experiences. I started randomly re-engaging with some friends that I had known from the teams that were out. I was pretty surprised, frankly, when they started sharing experiences that they had with psychedelics through an organization called Vets. These guys were people that I respected from the community, that were fantastic operators, guys they're the kind of guys that I looked up to as a SEAL. Having them tell me that this changed them for the better, opened them up and really was helping them and helping to heal them. I started to do a lot of research and ultimately decided to reach out to vets. My experience with psychedelic therapy was life-changing. It's healing. It's very healing. I feel like I've like dug down to the root problem and like addressed it. And every time I feel and like release, emotion, and I'm honest with myself, I feel like I'm like taking like a brick out of the ruck. And like every single time, I just feel better. I feel lighter, and I'm able to love deeper and enjoy the present moment. The reason I think it's been so impactful for me is because the program isn't, shoot from the hip and send people through this, mind-blowing experience. It's like deep preparation with psychotherapy, like the focus on integration and continued therapy, not because I'm broken, but because I'm like growing. It's galvanized habits in my life that I would have probably never touched before. I meditate every single day. I'm probably more committed to my physical pursuits in climbing and training for that. I love it. I love the way I feel waking up and doing mobility work in the morning. I love playing with my kids and letting them jump on my back while I'm stretching. I feel like it's given me a second chance to do the things in life that I should have been doing before, and appreciating life the way that I should have appreciated it. I've had friends of mine that I've served with take their life, and no family, no wife, no son, no daughter, no parent should ever have to go through that. That is making a massive impact in the fight against veteran suicide. I'm just so grateful that people like Marcus and Amber are willing to kind of put themselves out there years ago and do something because they know that it saved Marcus's life, and it brought their family back together. And I think for anybody that's struggling, any veteran that's struggling out there, don't worry about judgment or shame. Like, reach out to a friend, tell somebody, don't keep it hidden. And nobody can help if you don't let them know that you're struggling. If people want to help, to not only save veterans.
I'm going to stop that video here. Veteran PTSD statistics, according to the U.S. Department of Veteran Affairs, post-traumatic stress disorder statistics per given year for combat veterans are as follows. Iraqi Freedom and Operation Enduring Freedom, 11 to 20%. Gulf War, 12%. And the Vietnam War, 15% at the time of the study, which was conducted in 1998. Sadly, that has not been reconfigured that I could find. It's estimated that 30% of veterans, Vietnam veterans, have experienced post-traumatic stress disorder over the course of their lifetime. So what was interesting is what Nick talked about, a few of the things that he said is that the psychedelic treatment was able to help him dig deep down to the root of the problem. This is one of the issues that really affects the current first line treatment modality of exposure-based psychotherapy. Many of these veterans, they are unable to follow through with treatment plans because it is just too difficult for them to access the trauma. One of the other things that Nick talked about is that the therapy continues. So even though he went through this treatment, that it's like, not that he's broken, but it allowed him to take a brick out of the ruck. And every time now, because he's got the momentum going, he can continue therapy. He can allow himself to feel emotion, but he can also live his life. Unfortunately, one of the other limitations with current modalities is limited efficacy of pharmacotherapeutic interventions. Treatment resistance leads to self-harming behaviors and suicidal ideation. And unfortunately, in the United States, 22 soldiers take their life every day. The therapeutic dropout rates of veterans are 25 to 30%, and 30% to 50% of veterans who do complete services continue to experience symptoms and ongoing impairment. 40 to 60% of veterans receiving psychotherapy and pharmacological services do not reach clinical improvement. The need for neurological reprogramming for our veterans to transition back into civilian life post-combat or deployment is necessary to make sense of the experience after the fact in both moral, cultural, and psychopathological terms. We also have a need for community-based collective healing. Classical psychedelics were utilized were psilocybin, MDT, and LSD. Between 1950 and 1970, over 1,000 articles published on the treatment of patients utilizing psychedelics and with positive feedback. Unfortunately, in 1970, the Controlled Substance Act was enacted and made use of psychedelics illegal, even in medical or therapeutic modalities. In 2000, MDMA or ecstasy begins being utilized for assisted psychotherapy under clinical investigation for the use with patients with PTSD. And this really is when we start to see a shift in the use, once again, of psychedelic treatment. Following 2 drug treatment sessions through the use of MDMA, along with psychotherapy, 54.2% of participants who received the MDMA no longer met CAP scores for PTSD versus 22.5% of the controlled group that received therapeutic services only. Neuroimaging shows reduced amygdala activity and increased prefrontal cortex activity. Until recently, that we're starting to see these services become legalized in the United States, soldiers were participating in psychedelic retreats in countries like Costa Rica and Peru. Part of the essence of these treatments was that soldiers experienced treatment in connected environment, much like they were trained and fought in battle. They also got to heal in this same type of connected group environment. Preparation sessions prior to treatment and post, as Nick spoke of, they're intense therapeutic services that prepare for the treatment and in post-treatment. Treatments for the psychedelic portion of the treatment consist of 4 treatments over the course of a week in most cases. Psychedelic treatment in the United States is happening, and the California Center for Psychedelic Therapy, their quote on their website states, "Psychedelic integration therapy is designed to support the synthesis of the mind and body after experiencing a non-ordinary state of consciousness." I'm going to show you one last video about current research.
In these studies, psilocybin and MDMA has been found to decrease existential anxiety and angst if they're at end of life. And for addictions, it has decreased rates of relapse in an unprecedented way.
A person that is suffering from post-traumatic stress disorder reaches a certain threshold where they continue to experience suffering. The therapies that are being researched, they have demonstrated conclusively that you can get almost a total remission of post-traumatic stress disorder symptoms through the use of MDMA combined with proper preparation and follow-up.
It's called the Certificate Program in Psychedelic Assisted Therapies and Research, and it trains students to use psychedelic assisted therapies primarily with psilocybin and MDMA, FDA-approved medicines for research in the United States. The second goal for us with our students is to be available for expanded access, compassionate care programs later on as psilocybin and MDMA's last iterations of clinical studies are going on all over this country, for them to be in a clinic giving psychedelic assisted therapy to patients.
I work with communities of color and adults who are victims of crime. I think about how we can start to offer people who have severe trauma in their lives a possibility of a different kind of healing.
The faculty is world-class. Charles Grob and Ralph Metzner and Michael and Annie Mithover, it's mind-boggling.
It feels like a torch is being passed, and this group is fantastic. The teachers are fantastic. Everything about it. I can't say enough good things about this program.
The center is a pioneering program, training what might be the vanguard of a psychedelic research movement that will be able to optimize delivery of treatment and hopefully have a big impact on the evolution of the health and mental health field and on our culture at large.
The future that we're most excited about in the center is to be in an FDA-approved study that would utilize our graduates, all these licensed professionals who would like to do this here at CIIS. We're very excited to try and do that next. So that's our next future endeavor.
Okay. This was so short. I could have carried this discussion on for a couple of hours because there is a lot of information. So I hope I'm leaving you guys with lots of questions, lots of unanswered questions, and that you'll go and do some research yourself and learn more about psychedelic therapy. I've also done a Teachback discussion questions here. If you'd like to answer, that would be great too. I wish you all the best with your videos as well.